All right, let's get started with today's deep dive. You ready to explore those incredible kidneys of yours?
Always ready to talk kidneys.
Perfect. So you've sent over a ton of material on the renal system, really impressive lecture notes, presentations, even some really detailed diagrams.
Hmm.
I have to admit, I was a little intimidated at first.
Well, it is a complex system, but we'll break it all down.
That's the plan for this deep dive, to
Hmm.
really understand how the kidneys work, what can go wrong, and what happens when things do go wrong. Like,
Hmm.
what are your options? And to help us navigate all the complexities, I've got an expert here.
Happy to be here.
Okay, first things first. The thing that just blew me away when I was looking through your stuff was the sheer volume of blood that those two little kidneys filter every single day. Something like 20–25% of the heart's output.
It's amazing, isn't it? A non-stop filtration system, constantly working.
Yeah, it makes you realize how crucial they are for keeping everything in balance.
Absolutely, filtering out all the waste products your body produces, all the urea and creatinine, things you don't want hanging around.
Right, like a super efficient cleaning crew, but it's not just filtering, is it? I saw in your notes that they also regulate fluids and electrolytes, blood pressure, even red blood cell production. It's incredible how much those two little bean-shaped organs are responsible for.
It really is. And one of the key ways we measure how well they're doing is by checking the glomerular filtration rate, the GFR. A normal GFR is around 125 millimin.
125 millinolmin, got it. But I actually came across something interesting in the research that you sent over. One study found a surprising link between a declining GFR and high consumption of, get this, processed meats.
Interesting, isn't it? Even those everyday dietary choices can have a long-term impact on kidney health.
Yeah, it's a good reminder to, pay attention to what we eat. Speaking of GFR, you included this diagram, normal kidney function. And it really lays it all out. The kidneys are regulating fluid, filtering out the waste, producing those vital hormones like vitamin D, erythropoietin, and even regulating blood pressure through renin. But then it shows, a malfunctioning kidney and what happens when things go wrong. Fluid overload, the buildup of those waste products, what's it called? Uremia, and a whole cascade of other issues.
It really highlights the interconnectedness of it all.
It does. It's definitely a wake-up call to take good care of those kidneys. Yeah. Now, another thing that kept popping up in your materials was diabetic nephropathy. Can you tell me more about that?
Diabetic nephropathy is a big one. It's a common complication of diabetes that affects the tiny blood vessels in your kidneys, leading cause of kidney failure in the U.S., actually.
Oh, wow. So, how does diabetes actually cause damage in the kidneys? What's the connection?
Well, over time, high blood sugar levels can damage the glomeruli.
The glomeruli.
Yeah, those delicate filtering units in the kidneys. And that damage, it causes protein to leak into the urine. It's one of the first signs that something's not right.
Speaking of early signs, I read that foamy urine can be an indicator. Why would that happen?
Yeah, it seems strange, but it all comes back to that protein leakage. Normally, the glomeruli act like a fine sieve, keeping the protein in the blood where it belongs. But when they're damaged, protein slips through, creating that foamy appearance.
Okay, foamy urine. Noted. Definitely something to keep an eye out for. And then it can progress to something even more serious.
Yeah.
Nephrotic syndrome.
That's right. With nephrotic syndrome, a large amount of protein leaks from the kidneys, leading to all sorts of problems. Swelling, high cholesterol, it can get serious.
Okay, so we've seen how diabetes can directly impact the kidneys. Now, let's zoom out a bit. Let's talk about the bigger picture. Chronic kidney disease, CKD. How does that develop over time?
Well, it's a good segue because diabetic nephropathy is actually the most common cause of CKD. CKD is basically a slow and steady decline in kidney function. And what's interesting is that the kidneys are pretty resilient. They can lose up to 80% of their function before you really notice any changes.
80%?
Wow.
Wow. So, how do you know if you have it then? If the symptoms are so subtle, especially in the early stages?
That's where monitoring your GFR is really important. As CKD progresses, that number steadily goes down. And CKD is actually classified into 5 stages, each with a different GFR range.
So that 125 millimim that you mentioned, if it dips below that, it's a red flag.
Exactly, a signal to investigate further. And as CKD advances, as those kidneys really struggle to filter out those waste products, they start to build up in the blood. And that leads to uremia.
Uremia, that doesn't sound good at all. What kind of impact does that have on the body?
Uremia is a big deal. It can affect almost every system in your body. It's like a domino effect, really.
Yeah, looking at your notes, it's pretty overwhelming. Urinary changes, metabolic issues, electrolyte imbalances, impacts on the heart, the lungs, the gut, the brain, the skin, the bones. It's like no part of the body is spared.
That's right. The ripple effects of CKD are very far-reaching. For example, early on, you might notice changes in how often you pee. You might have to go more frequently, especially at night. But then as your kidneys lose more and more function, you might actually find yourself going less.
Okay, that makes sense given what the kidneys do, filtering all that fluid.
Yeah.
What about the metabolic stuff? The metabolic disturbances, what happens there?
Well, the buildup of waste products can actually interfere with how your body regulates blood sugar, which can lead to insulin resistance and problems with glucose metabolism. And you might see an increase in triglycerides, a risk factor for cardiovascular disease.
Right. And you mentioned electrolyte imbalances, specifically hyperkalemia, too much potassium.
Hyperkalemia is a very serious concern with CKD. Remember how we talked about the kidneys working so hard to maintain that balance? Well, if they can't filter out that excess potassium, it can build up in the blood, leading to some really dangerous heart rhythm problems.
So CKD is a pretty big deal. It's not just about the kidneys themselves. It's about the impact it has on, well, everything.
Exactly. And we haven't even talked about its effect on the blood yet. Remember that erythropoietin hormone we were talking about? The one responsible for red blood cell production.
The one the kidneys produce.
Yes. So if they're not functioning well,
Then you don't make enough erythropoietin.
that's right, and you end up with anemia, feeling tired, weak, short of breath. It's all connected.
Wow. Okay. So we've got problems with urination, problems with metabolism, electrolytes, and even blood cell production.
What about the heart? I'm guessing there's a connection there too.
Absolutely. High blood pressure is a major factor in both causing and worsening CKD. It's kind of a vicious cycle. High blood pressure damages the kidneys, and then the damaged kidneys further contribute to high blood pressure. And this, of course, increases the risk of heart attacks, strokes, all kinds of cardiovascular problems. Wow, one problem just leads to another. I'm starting to see just how interconnected everything is. But before we move on, can you give me like a few more highlights of how CKD impacts those other systems on this list, just to get the full picture?
Sure. So, fluid buildup in the lungs, that can lead to shortness of breath. That's the respiratory system being affected. You can also experience nausea, vomiting, even a metallic taste in your mouth due to that waste buildup. That's your digestive system. And neurologically, there can be fatigue, difficulty concentrating, even cognitive decline. CKD can even cause really severe itching and dryness. That's the integumentary system, your skin. And then there's the impact on your bones. CKD can actually weaken the bones. It's called renal osteodystrophy.
It really is incredible how connected the kidneys are to every aspect of our health.
And CKD can also significantly impact the reproductive system, leading to hormonal changes and potential fertility issues. It really is a whole body condition with huge implications for well-being.
Yeah, it really is. Going through all of this, it makes me realize that the physical effects are just one part of the story. Your materials mentioned the psychosocial impact as well, and I imagine that's pretty significant.
It is. Living with CKD can have a major impact on quality of life. The fatigue, the pain, the limitations from the condition itself, and then the demands of treatment. All of that can lead to feelings of depression, anxiety, and even social isolation. It's a lot to cope with, both physically and emotionally.
It really is. Okay, this has been such an insightful overview of CKD. I'm definitely getting a sense of how serious it is and how it affects, the whole person. But we've only scratched the surface, right? We still need to talk about what happens when CKD progresses and the options for treatment, like dialysis and transplantation, and that's a whole other deep dive.
It is. There's a lot to unpack there.
There is. So I think for now we should take a break and come back fresh to explore those topics in part 2 of our renal system exploration.
Welcome back to our deep dive into the renal system.
We've covered a lot of ground already, haven't we? Like understanding how vital the kidneys are and the impact CKD has on the whole body. But I'm ready to learn more. What happens when CKD reaches a point where your kidneys just can't keep up? What are the options?
That's where we get into renal replacement therapy, dialysis and transplantation.
And from my research, it seems like dialysis is usually the first step, right?
It often is, at least initially.
But it's not just one thing, right? There are different kinds.
Yeah, there are two main types, hemodialysis and peritoneal dialysis.
So let's break those down one by one. Can you walk me through what's involved in hemodialysis? I'm curious.
Okay, so imagine a machine that basically acts as an artificial kidney, filtering your blood outside of your body. It takes over the job your kidneys can't handle anymore.
So the blood actually has to leave the body and go through this machine.
It does. It requires creating a special access point, either an arteriovenous fistula, AVF, or an arteriovenous graft, AVG. These are surgically created connections between an artery and a vein.
And I'm looking at the diagrams you provided. Wow, it looks pretty intense.
It is a significant procedure, and ideally, that AVF is created well in advance because it takes time to mature.
To mature.
Yeah, to be ready for use. Think of it like adding a lane to a highway. It has to be built up gradually.
Oh, I see. So it's a gradual process.
It is. An AVG can be used sooner, but it has a higher risk of complications.
Like what? What kind of complications?
Things like clotting or infection.
Okay. And I see in your notes there's a special way to assess those access sites. Something about a bruit and a thrill. What are those?
A bruit is a whooshing sound you can hear with the stethoscope over the fistula or graft.
A whooshing sound, okay.
Yeah, it means blood's flowing. And a thrill is a vibration you can feel with your fingers. It's a way to make sure that access is working the way it should.
So if you can hear the whoosh and feel the buzz, you're good to go.
Exactly.
And I saw this in big, bold letters. No blood pressure or fees on the arm with an AVF. That seems serious.
It is. That AVF, it's a lifeline for the patient. It's essential for dialysis, so you don't want to risk damaging it.
So even something as routine as taking blood pressure is off limits.
Absolutely. And it's important to remember that only specially trained dialysis nurses should access the AVF.
Got it. Okay, so we've got the access down. Now back to the hemodialysis itself. There are different ways to do it, right?
Yeah, you can have in-center hemodialysis or home hemodialysis.
In-center, meaning you go to a hospital or clinic.
That's right. Usually 3 times a week for sessions that last about 3 or 4 hours each.
Wow, 3 times a week.
Yeah.
What about home hemodialysis? How does that work? Is it even possible?
It is possible, and it offers more flexibility, but it does require the patient or caregiver to be trained. They need to know how to operate the machine and manage the treatment at home.
So more freedom, but also more responsibility.
Exactly. And not everyone is a candidate for home hemodialysis.
All right, it's a big decision.
It is. It's important to weigh the pros and cons of each option, based on your individual needs and lifestyle.
Okay, that makes sense. Now let's move on to peritoneal dialysis. That's totally different, right?
It is. Peritoneal dialysis uses your body's own peritoneal cavity, the space in your abdomen surrounding your intestines.
Wait, so instead of an external machine, it's using the body itself.
Yes. It acts as a natural filter. A catheter is implanted surgically into the abdomen, and a special solution is infused into the peritoneal cavity. And this solution, it stays there for a while, allowing waste and extra fluid to move from your blood into the solution. Then it's drained out.
Okay, that's pretty amazing. Sounds like a much gentler approach than hemodialysis.
It can be, and a big advantage is that it can often be done at home, giving patients more control over their treatment schedule.
And are there different types of peritoneal dialysis too?
There are. The most common are CIPD, continuous ambulatory peritoneal dialysis, and CCPD, continuous cycling peritoneal dialysis.
Okay, those are some acronyms. What's the difference?
With CIPD, you manually exchange that dialysis solution a few times a day. It's ongoing, and you manage it yourself. CCPD, on the other hand, uses a machine to cycle the solution in and out overnight while you sleep.
So CCPD is more set it and forget it while you sleep.
You could say that. But choosing between CIPD and CCPD, or hemodialysis for that matter, really depends on your needs and your lifestyle. What works best for one person might not work for another.
It's all about personalized care.
Exactly.
Okay, now we've talked about these two main types of dialysis, but we need to talk about complications. What are the risks?
You're right. Dialysis, even though it's life-saving, it does come with challenges. Both hemodialysis and peritoneal dialysis have potential risks. Infections, bleeding, other complications.
You give me some specific examples. What could go wrong?
Sure. With hemodialysis, one of the biggest concerns is hypotension.
Hypotension.
A subtle drop in blood pressure. That can happen during or after treatment. Muscle cramps are also common, and there's always that risk of blood loss or clotting related to the access site.
Right. What about peritoneal dialysis? Any unique risks there?
Well, with peritoneal dialysis, the most serious complication is peritonitis, an infection of that peritoneal cavity itself.
Peritonitis.
Yeah, it can be very serious. It might even require hospitalization. And then there's potential for pain, hernias, difficulty with drainage, things like that.
Okay, so both types of dialysis come with their own sets of risks and benefits. And I know there's another type of dialysis mentioned in your materials, CRRT, continuous renal replacement therapy. What's that?
CRRT, that's a slower and gentler form of dialysis used in intensive care settings for patients who are really critically ill. They're usually too unstable for traditional hemodialysis. It's continuous filtration 24 hours a day.
So it's kind of like a specialized form of dialysis for like the very sickest patients.
Exactly.
Okay, so we've covered dialysis. That's a lot to take in. But there's another option we haven't talked about yet, transplantation.
Right. For many people with end-stage renal disease, that's the goal. It's a chance to live a life free from dialysis with their kidney function restored.
It's like a whole new lease on life.
Yeah.
So where do those new kidneys come from?
Well, there are two types of donors: living donors and deceased donors.
Living donors meaning like someone donates a kidney while they're still alive.
Exactly. It could be a family member, a friend, or even, an altruistic stranger. It's a pretty incredible gift.
It is. It's amazing. But how do they make sure it's, a safe and suitable match?
There's a very rigorous screening process. They have to evaluate the donor's health and ensure compatibility.
So blood type, all of that.
Blood type, tissue matching, it's all crucial to minimize the risk of rejection.
Rejection. So the body could reject the new kidney.
It's a risk with any transplant. The recipient's immune system may see the new kidney as, foreign and attack it. That's why recipients have to take immunosuppressant medications for the rest of their lives.
Wow. So even with a successful transplant, it's a lifelong commitment.
It is.
What about deceased donors? How does that work?
Deceased donors are individuals who have made the decision to donate their organs upon their death. It's an incredibly selfless act.
It really is. So how does the matching work?
Well, when a suitable kidney becomes available, it's matched with a recipient on a waiting list, based on blood type, tissue compatibility, and medical urgency.
So it's like a race against time.
It is. It's very time sensitive and requires a huge coordinated effort.
I can imagine. And I'm guessing not everyone can receive a transplant.
That's right. Certain medical conditions might exclude someone from being a candidate. Things like active cancer, severe heart disease, uncontrolled infections. And even if someone's medically eligible, they need to be willing to commit to, the demands of transplantation. Taking those medications, sticking to a strict medical regimen.
It's a big decision.
It is a big life change.
Okay, so we've talked about dialysis and transplantation, the two main approaches to renal replacement therapy. But what about people who choose not to go that route or aren't eligible? You mentioned something called conservative care.
Conservative care focuses on managing the symptoms of CKD and slowing its progression, rather than replacing the kidney function.
So like diet, medication, things like that.
Exactly. Dietary modifications, medication management, blood pressure control, really focusing on any complications that come up.
It's about making the most of your quality of life as your kidney function declines.
That's right. And conservative care also includes advanced care planning. So individuals can make informed decisions about their end-of-life care, make sure their wishes are followed.
Right. And your materials highlighted the right of patients to refuse or withdraw from renal replacement therapy, too. It's really important.
It is. It's all about respecting each patient's autonomy and honoring their choices, even in difficult circumstances.
This has been so informative. It's amazing how, technology can step in when the body's own systems fail. But I'm thinking about the day-to-day reality of living with CKD. We need to talk about, managing diet and medications, the importance of education and support, all those things that help people navigate this condition. Welcome back to the Deep Dive. We're on the last leg of our journey into the renal system, and, it's been quite a deep dive.
It has. But remember, knowledge is power, right?
Absolutely. So in this final part, let's get practical. What does it actually mean to live with CKD every day?
Good idea. Let's do that.
Okay, one thing that jumped out from your materials is diet. It seems like it plays a big role.
It does. It plays a huge role in managing CKD.
Can you talk about that a bit more?
Of course. So when your kidneys aren't working at their best, they struggle to filter out those waste products.
Right.
So the goal with diet is to make their job a little bit easier.
Makes sense. So what does a kidney-friendly diet actually look like? I'm curious.
Well, it typically involves limiting certain things like protein, phosphorus, potassium, sodium, and even fluids.
Whoa, okay, that's a lot. Why all of that?
Let's start with protein. When protein breaks down in your body, it creates waste products. And those are the very things that your kidneys are having trouble filtering out. So reducing protein intake helps lessen their workload.
Okay, I get that. What about phosphorus? I know it's important for healthy bones. Why limit that?
Right. Phosphorus is crucial for bones, but when your kidneys aren't functioning well, they can't remove excess phosphorus from the blood.
Uh,
And then that buildup can actually weaken your bones and contribute to other health
so
issues.
it's not just protecting the kidneys, it's preventing those other dominoes from falling.
Exactly. And potassium is another big one. High levels, that hyperkalemia we talked about, can be very dangerous.
Right, because of the heart problems.
That's right. And then there's sodium and fluid restrictions. Those are crucial for managing blood pressure and preventing fluid overload. Both of those can put extra strain on your kidneys.
It sounds like it's not just about cutting back on salt here and there. It's really paying attention to the details.
You've got it. And it's why working with a renal dietitian is so important.
Yeah, they can help you create a personalized plan, right?
Absolutely.
Okay, so that's diet. You also mentioned medication management in your materials.
Yeah, medications are crucial for managing CKD and any complications that arise, but it's important to be careful.
What do you mean?
Well, some medications can actually be harmful to the kidneys, especially if the dosage isn't adjusted properly. And a lot of medications need to be adjusted for people with CKD because, their kidneys aren't eliminating them as effectively.
So it's about finding that balance,
Yeah.
right? Managing the condition while also protecting the kidneys.
That's it. And it requires good communication with your healthcare team. They need to monitor things carefully.
So patient education is really important, right? Understanding the medications, the diet, the potential complications.
I can't emphasize that enough. Knowledge is key. You need to be an active participant in your healthcare.
Right. But it's also about support, isn't it? It's about having people to lean on.
Absolutely. Living with CKD can be very isolating, but there are support groups out there, both in person and online.
So you don't have to go through this alone.
You don't. It helps to connect with people who understand.
Okay, so as we wrap up our renal system deep dive, I'm taking away a few key things. Knowledge, awareness, and proactive management. Those are crucial for living well with CKD. It's a complex condition. It affects so much, but there's hope, right?
There is, absolutely. Early detection, good monitoring, a holistic approach to care, it all makes a difference. And research is constantly moving forward. There are new treatments and hopefully a cure on the horizon.
That's great to hear. And to our listener, thank you so much for joining us on this incredible journey. We hope you found it helpful and, maybe even a little bit inspiring. Remember, knowledge is power. And by working together, we can make a difference in the lives of everyone affected by CKD.
Well said. It's been a pleasure.
Thanks for joining us on the deep dive.